name is Avery Fuller. I'm going to be your provider for today's exam. Can I get your name and date of birth?
Kramer Smith, December 10th, 1992.
Awesome. And what do you prefer to be called?
Kramer's fine.
All right, Kramer. And what gender do you identify as?
Male.
Okay, awesome. So today I'm going to be doing an exam on you. The first portion is going to be an interview of just some history of you, and then the physical exam is going to be pretty comprehensive. I'm going to be asking you to do a few things, and I'm going to be placing my hands on you. Is that okay?
Sure.
Awesome. So let's start off by asking, what brings you in today?
I'm just here to establish care.
Awesome. Okay. So I've already washed my hands and I've donned gloves, and I would use this portion of the exam to talk about the history of the present illness that you're feeling, but since you're here to establish care, those questions are going to look a little bit different. So, how do you feel like your health is overall?
Well, I think it's pretty good.
Good. And what does being healthy mean to you?
Just being able to do whatever I want to.
Awesome. And you feel like you can do that, which is good. When was the last time you saw a doctor?
A few months ago, maybe.
Great. Any pain or distress that you have?
Not at the moment.
Okay. Have you ever seen specialists?
No.
Okay. So, we're going to go on to the past medical history portion. Do you have any allergies?
No.
Awesome. And were you diagnosed with anything as a child, such as chickenpox, asthma?
I did have chickenpox when I was about 3.
Okay. And what about as an adult? Any health concerns?
There have been a few. So I found out as an adult that I only have one kidney, but that was something I've had since birth, so it's not really a concern. Just kind of something we keep an eye on.
Okay.
I do have Parkinson-White syndrome.
Okay.
But I had an ablation for that when I was 12, and I haven't really had any issues since then.
Okay.
And then I was also recently diagnosed with hypertension.
Okay. So that ablation was the only surgery and hospitalization that you've had?
Yep.
Okay. And do you take any medications?
I take losartan 25 milligrams a day for the high blood pressure.
Okay. When was the last time you took it?
This morning.
Okay. Do you take anything else?
Just some like Tylenol and ibuprofen over the counter occasionally if I have a headache. But
okay. And do you check your blood pressure every day?
I do.
Okay. Awesome. So how do you keep up with your health? How do you?
I just try to stay active. Work helps with that a lot, and just trying to eat as healthy as I can.
Good.
So,
do you sleep well?
I like to think so.
You get plenty of sleep?
Mm-hmm.
Okay, good. And what about immunizations?
Yeah, I've had all my vaccines. I got the flu shot this year and the COVID vaccine, so I think I'm all up to date on everything.
Okay, awesome. So next I'm going to be asking about your social history. Are you married?
Yep.
And how long have you been married?
5 years.
Awesome, awesome. And what is your highest level of education?
I took some college classes, but I've never finished my degree.
Okay. Are you employed?
Yeah, I'm a bartender at Longhorn Steakhouse.
Do you drink?
Occasionally, maybe 1 or 3 times a week.
Okay.
I'll have just like a glass of whiskey, an ounce or 2.
Okay. Do you do any illegal drugs?
No.
And do you smoke?
No.
Good. Okay. So, have you been out of the country in the last 6 months?
Mm-mm.
All right. Do you feel like you have a support system?
I do.
Good. How do you deal with stress?
I really try not to let it get to me. I usually am pretty good at just kind of letting it go.
So we have healthy outlets to do that?
Yeah, I think so.
Good. Okay. So the next thing I'm going to ask you about is your family history. How many siblings do you have?
3.
Okay. And do they have any health concerns?
Not that I'm aware of.
Awesome. What about your parents?
No, my dad has hypertension as well. I do think he was diagnosed around the same time I was in his life, but aside from that, I don't think anything else.
Okay, awesome. What about grandparents?
Nothing that I'm aware of. I mean, they're both in their 90s, so I'm sure they're not in, pristine health, but nothing serious.
So no family history of cancer, stroke,
No.
diabetes, anything like that?
Nothing like that.
Awesome. Okay, good. So, do you have any questions for me so far?
I think so.
Great. The next thing I'm going to be doing is what's called a review of systems. We're going to be going from the top and addressing any concerns or issues that you have all the way down. So just answer it as openly as you can, okay?
Sure.
So you said that you feel like your health is pretty good in general.
Mm-hmm.
Do you have any chronic pain or fatigue? Any unexplained weight loss?
No.
Okay, good. How about your head? I know you said that you had headaches.
Yeah, it's fine. For the most part, just occasionally I get a headache.
Any dizziness, loss of consciousness?
No, nothing like that.
Great. Any vision changes?
No.
Any drainage from your eyes?
Mm-mm.
Any hearing changes?
No.
Any drainage from your ears? What about your nose? Any?
I do have a little bit of sinus drainage. I think it's just due to the weather change right now, but.
Okay. What about your oral care? Any missing teeth?
No.
Great. Any difficulty swallowing? Any bleeding from your gums? Any swelling?
No, I gums bleed a little bit when I brush my teeth sometimes, but other than that, everything's okay.
Okay. Do you ever have any shortness of breath or where it's hard to catch your breath?
No.
Good. Any issues with your heart? Any palpitations?
No.
Okay. Do you have any numbness or tingling in any of your extremities?
No.
Good. Do you breathe easily?
No.
Do you have any acne or rashes?
I get some acne on my back sometimes, but that's about it usually.
Okay. Any excessive sweating?
No.
Nothing like that? And no rashes? You said you didn't have any allergies?
No.
Okay. What about your GI system? Do you feel like your bowel movements are pretty regular?
I do.
Okay. They're always formed, no diarrhea, no abnormal coloring?
Correct.
Okay, good. What about urination? Do you feel like you pee well?
Yes.
Okay, good. So, any problems with your daily activities?
No, I pretty much do what I want to every day. So.
Awesome, good. How is your libido?
It's okay. It's not as high as it used to be, but.
Okay. Any testicular pain?
No.
All right. So that's going to actually conclude our interview portion. The next thing, like I said, is going to actually me putting hands on you and assessing you, doing a comprehensive assessment. Do you feel like I missed anything or anything you thought about that you want to tell me?
I don't think so. Well, you'll see in a second. I have 2 different size pupils.
Okay, good to know. Since birth?
Yep. Since
okay,
birth.
good to know. Anything else?
No, I think that's it.
Okay, do you have any questions for me?
I'm good.
Awesome. So the first thing we're going to do is I'm going to take a look at your head. I can see that it's the appropriate size and appropriate shape. Nose is symmetrical and intact. Mouth is symmetrical and intact. Ears are the same size. They're symmetrical and both intact. So the next thing I'm going to do is palpate his scalp for any lumps, bumps, scars, abrasions, anything like that. Does it hurt when I do this?
No.
Does it hurt when I do this?
No.
Great. So I can see his hair pattern is exactly as I would expect for an almost 30-year-old man. He does have the beard. There's no hair loss. There's no hair thinning. So we will move on to facial expressions. We're going to test cranial nerve number 5. So I'm going to ask you to smile and stick your tongue out and make a shocked face. Excellent. That was actually cranial nerve number 7. Cranial nerve number 5 is jaw strength. So I'm going to ask you to resist me. Great. And then open your jaw. Great. Once again, I did wash my hands. I have my hand sanitizer here. So the next thing we're going to look at is your eyesight, okay? You said that your eyesight was pretty good. I have this newspaper clipping, and I'm going to ask you to read it for me.
It says missing €1,500 reward.
Beautiful. So the next thing I'm going to do, I do not have an ophthalmoscope, so I do have a pen light. And I'm going to test cranial nerves number 3, 4, and 6, and extraocular movements. So if you could just follow this pen light for me with just your eyes. Perfect. Perfect. And now we are going to take a look at those pupils that are different sizes. Perfect. They are very brisk. They do constrict on command, which is good, but they are different sizes. So, no draining, no anything. Everything is symmetrical with that. Very good. The next thing I'm going to look at is the ears. So I already said that they were intact. I'm going to start palpating them. Any pain?
No.
Good. Any pain on this one?
No.
Perfect. So I'm going to locate the pinna. I'm going to pull it up and out. I do not have an otoscope, so I'm going to be using this pen light for examination. The external ear doesn't have any bruising, scarring, any bumps, lumps, anything like that, and no drainage. I see no drainage in the inner ear, and the tympanic membrane looks exactly as it's supposed to. So now I'm going to be doing the exact same thing on the other ear. Pinna up and out. Great, perfect. Just like the other ear, tympanic membrane intact and exactly as it's supposed to. So the next thing I'm going to be looking at is the nose. So I'm going to be shining my light up in the nose. Everything looks exactly as it's supposed to. And can you open your mouth for me? Pharynx is within normal limits. No missing teeth. Tongue is of appropriate size. I do not see any swelling or bleeding at this point. Mucosa is moist and pink. Do you have any questions for me so far?
No.
The next thing I'm going to do is assess nares patency. So I'm going to be doing this by occluding one nostril at a time, okay? And then I'm going to just be asking you to breathe through your nose. Perfect. And that is very patent. I'm going to be concluding this portion of the exam by reaching around and checking your thyroid. So if I'm going to just palpate it, and then if you could swallow for me. Perfect. And then I'm also going to be looking at your lymph nodes, okay? So I'm going to be looking at the preauricular, postauricular, occipital, the tonsillar, the cervical, the mandibular, the submental, and the maxillary. None of those lymph nodes were palpable, fixed, immovable, anything like that. Everything is exactly as it was supposed to look. So for this next portion of the exam, Kramer, I'm going to ask you to take your shirt off. Is that okay?
Sure.
So I'm going to ask you to take your shirt off and also put your legs right here. This portion of the exam is going to be looking at the respiratory part. Once again, washed hands. I'm going to be inspecting. Can you sit up straight for me, please? As straight as you can. Perfect. So I'm going to be inspecting at first. I don't notice any of the acne that he said that he had. Everything, he's not using accessory muscles. His respirations are even and unlabored. So next I'm going to be palpating. So does this hurt? Any of this hurt?
No.
Great. So no tenderness. I am going to be palpating for tactile fruitus. So could you say 99 for me?
99.
And again?
99.
And again?
99.
Perfect. So I could feel that in all lung fields. And then I'm going to be palpating for thoracic expansion. So if you could take a big deep breath for me. And out. Perfect. Everything was even and symmetrical. The next thing I'm going to be doing is percussing. We're looking for nice resonant sounds. Which we're getting. Next, we're going to be auscultating with the diaphragm of the stethoscope, all lung fields. Take a deep breath for me. And out. Excellent. Normally during an examination, I would also do this on the anterior portion as well, but I will not be doing that during this examination. If I can get you to swing your legs back in front, we're going to be moving toward the cardiac portion of the exam. Just looking at him now, I note no vascular irregularities on his chest wall. So we are going to be listening to his carotids, and then we're going to be listening to each area of the heart with both the diaphragm and the bell stethoscope. So we are going to be listening to the aortic area, the pulmonic, Erb's point, the tricuspid, the mitral, and again, each of the 5 areas, looking for any extra sounds, clicks, murmurs, and I do not hear any. No bruits in the carotid. Next, we are going to be looking at pulses and capillary refill. So I'm just going to listen to your carotid. Okay, +2. +2. If I can get for you to stick your hands out, great. +2. +2. I'm going to squeeze the tips of your fingers. Cap refill is less than 2 seconds bilaterally. Next, I'm going to be. You got your feet. That's okay.
It's a little cold in here.
Yeah, I'm sorry. Okay. Pedal pulses, and he has excellent pedal pulses. And then posterior tibial pulses, excellent too. Both +2 bilaterally. And then I'm going to be squeezing your toes. Excellent. And cap refill is also less than 2 seconds on those as well. I'm going to be washing my hands next. And then I'm also noting no edema. Coloration of the skin is great. There are no areas that are pale. Everything is warm. Hair pattern on his fingers and his toes denotes good blood flow as well. So I'm going to be asking you to actually lay down with your head to that side and your feet to this side. I'm going to be doing a few more things. So here we're going to evaluate the PMI, or point of maximum impulse, and you can't really see it or the shadow, so that's fine. And then also looking for any JVD, which I do not see. There's no edema. So we are going to be going to the abdominal portion of the assessment, and first we're just going to be inspecting the abdomen. The abdomen does not look rounded. It is very flat. It looks soft. There is once again no regular venous patterns on that. So we are going to be auscultating that first with the stethoscope. Starting in the right lower quadrant. Bowel sounds are normoactive for this patient. And we're going to be listening to the aorta. So no bruit in the carotids, no bruits noted in the aorta. Excellent. So the next thing we're going to be doing is percussing the abdomen. We're looking for tympanic sounds. We can also percuss the liver and the spleen. We did note tympanic sounds. Next, we're going to do light palpation. Just let me know if this hurts, Kramer, okay?
Mm-hmm.
You okay? Laying down?
Mm-hmm.
Good. Next, we're going to do deep palpation. So we do a two-handed technique. This is when we're evaluating further pain in organs. We can feel the organ in the right upper quadrant, spleen in the left, and normally kidneys. But we only have one kidney with Mr. Kramer, so I need you to sit up. Great, so that concludes the abdominal portion of the exam. Next, we're going to go into the musculoskeletal. Would you like to put your shirt back on?
Oh, sure.
Awesome. So next we're going to do some range of motion exercises. So if I can get you to put your hands on your lap and just flip your palms up and down. Great. So fine motor skills, upper extremities are great. And then if I could get you to take the heel of one foot and drag it along the shin of the other foot up and down a few times. Great. And then the next one. Great. So I've washed my hands once again, and I'm going to just be feeling your major joints, okay? So we're doing this. Any pain? There's no swelling. Shoulders, elbows, wrists. None in the knees. I'm going to be looking along your back too. If I get you to stand up real quick. Not in your hips. Can I get you to shrug your shoulders? Okay, and then put your elbows up and down. And then roll your wrist for me. Roll your neck. Give a half moon. Good, and then unhinge your hips. Excellent. You can sit back down. I can get you to swing your knees for me. And then rotate your ankles. Perfect. Range of motion is great. So next we are going to focus on skeletal muscle grading, okay? So can you squeeze my hands? Perfect. And I'm going to ask you to resist my motion. So the first thing I'm going to do is pull toward me. So just pull your hands toward you. Great. And then I'm going to push. So you push back. Great. And then I'm going to do the same thing with your legs, okay? Mm-hmm. So I'm going to push. You push back. I'm going to pull. You pull back. I'm going to push. You push back. I'm going to pull. You pull back. And then I'm going to do the same thing with your feet. So just use my hands and rub like you're riding a motorcycle. Perfect. Okay, once again, I'm going to wash my hands. And then the final thing we're going to do is we're going to do reflexes, okay? So I don't have a reflex hammer. I'm going to be using my stethoscope. All of those were 5 out of 5 strength, which is good. It's exactly what we would want. I'm going to be doing brachial, brachioradialis reflex. Great. And then on this side, brachial. Brachioradialis, great. And then I'm going to be doing the patellar, the knee reflexes. Great. And great. Do you have any questions for me, Kramer?
No, I don't think so.
Nothing at all? No. Okay. Well, then that will conclude our exam. You can always call the office anytime if you think of one. And just, we hope to see you again soon. Take care of yourself, okay?
You too.